Hi, everyone. Welcome to the Reflux, Colic and Constipation webinar. I am Dr. Anna Saylor with Every Chiropractic Center, and we're located in Roanoke, Michigan. And I'm so excited you're here. So the biggest thing, if you're watching this webinar, we totally get that you're stressed. We know that you're exhausted. We know that you're dealing with a baby that's crying. We know that you're dealing with a baby that's uncomfortable. And we know the struggles are real. So we hear them all the time in our office. New moms, babies that are just uncomfortable and they're stressed and they have all these issues. And it's one of those things like we get it. Because we hear it all the time. So once again, I'm Dr. Anna Saylor with Every Chiropractic Center, and we're here to help and offer you some hope, okay? So let's dive in. So the biggest thing is we know as moms, I'm a mom, we tend to blame ourselves for a lot of things. We are searching for answers, especially if you have a baby that's been speaking up, especially if you have a colic baby. You're searching for these answers. You've tried everything. I mean, you've tried everything, literally. Like, you Google, how can I help my baby with colic? And, you get a million different ways to help. And not all of them help. And some of them seem a little crazy. So we know that you're looking for a solution. And that's really why you're here watching this webinar. So the three topics, reflux, colic, and constipation, may seem unrelated, but they're all tied in together, and we kind of see a pattern here at the office. If you have one, it develops into another, which then develops into another. So, and they just get bigger, better, worse as the baby grows. Because we know that you're going to hear it all the time. Oh, the baby will grow out of it. Oh, don't worry, the baby's going to be fine. So I want to say the number one thing as a mom is to trust your gut, to make sure that you're listening to yourself and your own gut. If you think something is going on, if you think something's wrong, chances are something's wrong. Something is going on with your baby. Babies shouldn't just cry because they want to cry. That's not normal. So it usually starts about, and we are hearing it actually earlier and earlier. We're seeing that babies that start, early at 2 weeks, when they're stressed, become stressed babies at 3 months and become stressed babies at 6 months and are stressed toddlers and become stressed children, especially stress. That is a key thing we're talking about right now because we are in a stressed society. So stressed out babies become stressed out children, who become stressed out teens, who become stressed out adults. Okay, but each stress looks a little different. So a 2-week-old baby's stressed nervous system is going to look a lot different than a 1-year-old. So they're going to have what we call like stress markers, and you're going to wonder what's going on with them. And it's more like baby can't tell you what's going on. They can just cry. They can just be tense. They can just be uncomfortable. They can not like their diaper change and you don't know why, or they don't like the car seat and you don't know why. And there's something going on, and we want to make sure that you have some answers. So let's kind of go through a couple key things, normal versus common. And we hear this for everything in our practice. We hear, oh, it's just my normal headache. So as an adult, we hear it all the time. It's my normal headache. Well, first of all, just because something's common doesn't mean it's normal. You shouldn't have a normal headache. You shouldn't have a child that cries 3 hours a day, 3 times a week for, just cries. Just because it's common doesn't make it normal. It's not normal to have reflux. It's not normal to have colic. It's not normal to have constipation. It's common, but not normal. So we want to really, this is where I talk about you trusting your gut too. If you think something is not normal, it's not. So it's time to get answers, okay? Okay, so one of the key things, and we talked about how those three tie together, it's one of the things that no one looks at. So we are chiropractors and we look at the nervous system, and it is one of those things that no one looks at. A stressed out nervous system can be it can be the key to a lot of things that you're dealing with. And there's no other doctor that looks at the nervous system the way we do. There's no other doctor that puts that one piece of the puzzle, because we know you've tried everything. When you have a baby that has reflux, you're looking at should I change the formula? Is it something I'm eating if I'm breastfeeding? Are they getting too much? Are they not getting enough? Looking at colic, why are they crying? And, maybe I should do an infant massage. Maybe I should put them in the car and drive them around. Maybe, you're constantly trying new things. And we hear it all the time here, like, why didn't I know about chiropractic sooner? Why didn't I know about a stressed out nervous system sooner? It's the number one thing we hear, like, I wish I would have known sooner. So that's why you're here. That's why you're here on this webinar, to listen to looking at some things differently. We want to look at that last piece of the puzzle. We also, as chiropractors, look at the body as a whole. So we don't look at it, we don't compartmentalize the body. So we want to look at the whys, the root causes of it. We want to look at the whole baby, and from head to toe, what's going on. Okay. So let's kind of talk about some of the different issues with the ages. So we know each age is going to have a little bit of a different symptom per se. So when a baby is 2 weeks old, or a new baby, you're going to see things like latching difficulty. You're going to see trouble nursing from one side to the other. You're going to see a baby that's just tense. So I do have my little baby here, and this is Drake. So you're going to see a baby that's just a little tighter. They might have more tension in their body. They might not want to uncurl their hands. You might see things like they're not gaining weight. It's super important when the baby's at the very beginning that you're like weighing ounces. And if a baby's not gaining weight, what's going on? So then going into the next phase, which is usually about 2 weeks, you're going to see more stiffness. So they're going to show, and this is Drake here, when they change their diaper, they just are really tight. We see it a lot of times in the practice when we lay a baby down, they should lay down nice and easy. Arms should go to both sides nice and easy. Head should be able to rotate nice and easy. They should be relaxed. Their hands should be open and calm. If you were to raise their arms up, you do Drake's, you lay them down, and you were to raise both arms up, they should go nice and easy. There shouldn't be any tension in the baby. It should just feel like they're nice and relaxed. And that's one of the things we hear, like they're more tense. The other thing too, which is actually kind of interesting, oh, my hair's going crazy. We'll hear a lot like, oh, look at how he's holding his neck up already. Well, 2-week-old babies shouldn't be holding their neck up. If they're holding their neck up, it's because they're stiff. They should actually have that natural relaxation and then give. If they're already holding their neck up and you're like, oh, I'm so proud, they're holding their neck up, look at the strength in their neck, that's actually a sign that there's something going on. So we want to look at like that tension and making sure, like I always say, draw a line down the baby's body, and the right side and the left side should be equal and balanced. Okay. 4 weeks on, they're going to have, especially from earlier, they're going to have more difficulty starting to go to the bathroom. So this is when we kind of see some different, when people talk about regressions, like, oh, he used to go to the bathroom, no problem. And now he's straining a little more. Now we're seeing a little more tension one side to the other. Those are the kind of things to start looking at as they start aging. 6 to 8 weeks is when they start spitting up more. They're a lot more uncomfortable. They're a lot more fussy. You start wondering, like, am I overfeeding them, or are they not getting enough? And maybe it's something I'm eating, and maybe it's the formula. And you start questioning everything you're doing, because this is at the point where it's kind of, we always say things start at the top and then they start driving down. So things start here and then it's in their throat. So now this is where the spitting up comes in. 3 to 4 months is the colic. This is when, and I really dislike the diagnosis of colic because it just means they're crying and they're just unhappy. And the goal of all of us as parents is to have a happy, healthy baby. So you have a baby that has sleep aggression. So they're in the witching hour, especially. We hear it all the time, like, oh my gosh, from 6 to 8 p.m. it's just screaming uncontrollably. And that should be just a calming time. There shouldn't be a such thing as a witching hour. You are seeing the babies just cry, and as a parent, nothing is worse, and it never gets easier. My kids are getting older, and it just never gets easy to watch your child be uncomfortable and be unhappy and cry. Then it's, 4 to 6 months, you're looking at that next phase, which it is where they're really not like in their car seat. They're really not sleeping well. That can lead to things like we're seeing torticollis, we're seeing plagiocephaly, we're seeing flat heads on the different sides. So it just keeps getting worse. Like I said, things that start out bad get bigger and badder. If you're not taking care of the root cause, they're just going to keep progressing. Okay, so let's kind of get into neurology of the causes and the whys. Like I said, things start here, they drive down deeper. So the reflux is going to be the upper part of the chest. That's the top third. And so as things settle here, things are coming back. And as they age too, that's where the constipation, because it gets lower in the lower digestion. It's the last third of the digestion system. So it's why things are driving deeper. So kind of let's talk about the stress nervous system. So kind of the causes. It's one of those things that, like I said, no one ever looks at. No one except for chiropractors. That's our specialty. That's what we do. Why is the nervous system stressed? So let's kind of talk a little nerd-wise. So I have this handout, and it's a little hard to see. You have two sides of the nervous system. You have your sympathetic side and your parasympathetic side, and everybody has these two sides of the nervous system. Your sympathetic is your fight flight. That is, and you need it to go. You need it to be able to fight. You need to be able to fight. Your parasympathetic is your rest and digest side. Okay, so the easy way to think about it is the gas and the brake of your car. So sympathetic, gas of the car. It's your go, 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 go. Parasympathetic would be your brakes of the car. It's your rest. It's your digest. So when you're driving a car, you need both. You need gas to go, brakes to slow down. Okay, same thing with your nervous system. You need your sympathetics to go, your parasympathetics to slow down. The problem is that we are living in a stressed society where we're living where the sympathetics are on, the gas is on. I use my analogy is that you're like your beautiful car and you're driving down the road doing 100 miles an hour. And that's exactly what your babies are experiencing too. They're just stuck in that fight flight. They're stuck in sympathetic. They're stuck with their adrenals on, their stress centers on. And then chiropractically, what we want to look at is the parasympathetic, and that's the rest and digest, because you can't be in both. If you think about driving a car, you can't be on the gas and the brake. It doesn't work as well. It doesn't work good at all. But if you're trying to go and then trying to slow down, you're constantly jerking the car. So it's the same thing with your body, your nervous system. It's go, 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 slow down. Go, 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 slow down. So you can't be in growth and protection at the same time. You can't be in fight, flight, and rest and digest at the same time. And for us, rest and digest is the most important thing when you're pregnant and when new babies are born, because that is where growth, healing, immune system, digestive system, all those things come online. So you want to be in parasympathetic. You want the babies to be in parasympathetic. You want them to be in rest and digest. Because doesn't that sound beautiful? A baby that sleeps, a baby that eats, a baby that poops, all those wonderful things that are going on for their body, for their health, and to have a happy baby. Okay, so we talk about, there's a calming nerve at the very top of the neck called the vagus nerve. The vagus nerve, and it's hard to see behind me, but we have a couple different charts. It's easier to explain in person on those. But there's a vagus nerve, which is the calming stress nerve. And vagus means wander, and that nerve wanders through the body. And so we can see things going on at the top of the head that are causing a lot of things, especially the gut digestion system, that whole area. If it's stuck here and it's not, the calming nerve is not on, you're going to see a stressed baby, okay? So now, I'm sitting here saying stressed baby, and it sounds like, why would my baby be stressed, right? Like, that doesn't make any sense. I know I'm stressed. I know, my older kids can be stressed because, they have school, they have social media, they have all these things. Why would my baby be stressed? And it actually starts in the womb. So it's starting before the baby's even born. We talk about 3 T's here in the office. So 3 T's that cause stress to the nervous system. And these are for babies and adults, kids, everyone. 3 T's: trauma, thoughts, toxins. So trauma. What's the number one trauma to a baby? The birthing process. So if you think about the birthing process, and it could be whether it's a long delivery or a short delivery, both are traumatic to the baby. If the baby's in a position like a breech position or a facial presentation position, that can be a trauma to the neck. I mean, what's the very first thing you say if you were to hand this baby to a friend? And what do you say? Okay, cradle the neck, watch the neck, okay, hold the neck. But if you think about the delivery process, if you've ever watched a delivery, not so fun in the baby's neck. So that's the number one trauma. I have a report, that was talking about a study, 100 newborns of healthy babies. So they studied healthy newborns, 100 of them. 99 of them had an issue in the upper part of the neck. So this is healthy babies. So if you have 100 or 99 out of 100 healthy babies have an issue, you can't really get that much worse. So that's a physical trauma. Also think about pregnancy, uterine constraint. If the baby's in that breech position, or if you were pregnant and the baby always sat on one side, the baby was always on the right side, the baby always felt, if you felt tension, the baby's already starting with tension. So that's trauma. A couple other traumas, stressful deliveries we talked about, but getting that, this is where that gas pedal gets stuck on. Okay, so that's usually the number one thing for babies is trauma. Second T is thoughts, which is stress. And this is the hard one to talk to our moms, because you don't want to think about your pregnancy as stressful. You don't want to think about it as, that you were unhappy at any point. But if you think about pregnancy is becoming a much more stress state. We're having much more high-risk deliveries. We're having much more high-risk pregnancies. We're having much more ultrasounds. They're really stressing you out. One of my amazing assistants here just had a baby last week, and she was being told that the baby's going to be a big baby, big baby. They kept saying big baby, and I was like, he's not going to be a big baby. He's going to be, my guess was 8'12". I was like, he's not going to be bigger than 8'12". And I mean, they were really stressing her out, and she got to the point where she was like, I don't want to even have another ultrasound. I don't want anybody to talk to me about it, because they were really like pushing for it. And he came out and he was 8'6". So this big baby was just, it wasn't a big baby, but it was stressing her out. So think about the things that, and we have to ask you when you come in, this is why we see so many pregnant patients, because we can really affect the stress and help that sympathetic go away and the parasympathetic come on board, because you're stressed. So that's the emotional part of it. And then the last one is, the third T is toxins, and that's chemicals. There was another study that is very interesting to me. So if you think about chemicals, and a baby's in your womb, you think like, okay, they're getting the stuff that, they're getting the stuff that we want them to get. This study was done in 2005. So if you think about it, we're 2020, so 15 years later. And if you tell me that 15 years later, we're less chemical society, we're less toxic, I'd tell you're a little crazy. But 2005, this study was done, and they studied umbilical cord blood. So think about, this is before the baby's born, umbilical cord blood. So baby's not been exposed to anything yet. The study said they found 287 chemicals in the umbilical cord blood. 180 of them were known carcinogenics. So 287 chemicals in the blood of the baby before the baby was even born. How scary is that? Now it's 15 years later. So we are just, the environment's so much more toxic. So the things we're putting on our skin, the things that we're eating, dairy, gluten, all these things are chemical toxic that cause issues to the body. So that's how your nervous system gets stuck down. That's how the gas gets stuck. The three T's: trauma, thoughts, toxins. If you have a stressed mom, you're going to have a stressed baby. And if you have a stressed baby, you're going to have a stressed baby, toddler, and then a stressed kid, and a stressed teen, and a stressed adult. It never stops. So my question to you is, let's figure out a way to stop it. Let's figure out a way to put the brakes on, literally, and stop the stress cycle. And that's where chiropractic comes in. you're watching this and you're like, okay, she's a chiropractor. Like, why is she talking about this? Chiropractors, what we focus on is the nervous system. Our job is to bring those brakes on. Our job is to make sure that your parasympathetics are on board, make sure that that growth, that healing, that rest, that digest comes on board. And that's what you want. If you're dealing with reflux, colic, constipation, you want all those things. You want the baby to rest. You want the baby to sleep. You want the baby to eat. You want the baby to poop. All those things. Okay. So let's talk about chiropractic for babies, because a lot of people, like, you hear it and you're like, oh, wait a minute, I don't know about this. So first of all, I've been in practice for 21 years. And I am a pediatric chiropractor. So I specialize in women and children. It's a 3-year degree on top of my chiropractic that focuses on just babies. And baby adjustments for babies are completely different than adults. And then what we do here in the practice is completely different too. We use a technique called KST, which is Koren Specific Technique. It uses a handheld tool, and I have it right here. This is the handheld tool. Super, super gentle, very, very specific. So there's no cracking, there's no popping, there's nothing scary. We have videos posted of babies getting adjusted, and we have pictures of, our office. If you look at our Facebook page, is filled with babies and kids because they love getting adjusted. At this point, we've seen so many babies when they were born, and half the time I didn't even know what the color of their eyes were because they were sleeping through the adjustments. So it's amazing to watch a baby just melt in that tension release. And a lot of times you'll see our hands and it's just holds. Super gentle, super specific. So it's not what you think chiropractic is. It's a completely different way of looking at the body and looking at the baby. So that's kind of, what we want you to know is chiropractic for kids is completely different. I hear all the time, like, oh, what are the side effects? And I was like, oh, better latching, better eating, more relaxed baby, a sleeping baby, a happy mom, happy fit dad, a happy family. Because, we know when you have a baby that has reflux or colic or constipation, it affects everybody. It affects the whole household. It affects you as a parent. It affects the baby, obviously. But when they're not feeling good or they're unhappy, that is going to translate to everyone. So don't you want to look at something different to see if there's hope out there, to see if there's anything that you can do to make a difference in this baby's life? So my call to action to you is find out. Call us. Find out where their nervous system is stressed. So we have an amazing technology in our office. We don't do x-rays here. There's no radiation. And it's a nervous system scan that gives us exactly what's going on with your newborn, exactly the areas of stress, and how we can help them. So it's amazing when it looks at it, when we look at it and you're like, yep, here, here, and here, and we know exactly what's going on with your baby. So that would be my call to action. If you are sitting here wondering if we can help, we can. Call us. We are offering the scans to the babies. We do the same things for adults too, because we know if they're stressed, you're stressed. So happy baby, happy parents. So once again, I'm Dr. Anna Saylor with Every Family Chiropractic Center located in Rolick, Michigan. And we are here to help. If you have a chiropractor that you love, call them. Make sure you get an appointment. If not, we would love to be your family's chiropractor. So just give us a call. If you have any questions, please reach out. I am available on Facebook, and you can always call the office and talk to me. So once again, I hope everybody has an amazing day, and we will talk soon. Bye.